COVID-19 infections in China are rampant. 90% of people in Hunan province alone are thought to be carrying the virus. Some European countries have responded by demanding negative tests from anyone arriving from China. France, Italy and Spain have already imposed their own rules. China's government says that the restrictions are both unreasonable and unacceptable. So is the EU's COVID response justified? Alternatively, does it perhaps not go quite far enough? Welcome to the programme. I'm Philip Hampshire. After 3 years of largely being cut off from the world, China's government has relaxed its zero-COVID restrictions. Visitors to China no longer need to quarantine, and Chinese citizens are again free to fly abroad. But when a number of Chinese visitors tested positive after landing in Italy recently, there were calls for the European Union to bring in bloc-wide restrictions. Meanwhile, Beijing has threatened to retaliate, and the EU failed to agree a full response, and instead they left it up to individual countries. So, did Brussels act decisively enough, and was it intimidated by China? In the Chinese capital, Beijing, Andy Mark is Senior Research Fellow at the Centre for China and Globalization. Meanwhile, in Leicester, in England, we're joined by Dr. Julian Tang. He's a clinical virologist, Respiratory Sciences Department at the University of Leicester. And from Geneva in Switzerland, we have Antoine Flahault, who is the Director of the Institute for Global Health at the University of Geneva. Thank you very much, everyone, for joining me. Andy, first question, I'm going to send it across to you. Is the European Union justified in its current strategy towards China and its restrictions on Chinese travellers?
Well, as far as I know, I don't think that these measures are based on science. But I would defer to our other panelists on this. It certainly seems like it's politically motivated. It's a bit of showing a little bit of a temper tantrum, perhaps, towards China because of dissatisfaction in other areas of the relationship. And certainly, I think it's not good for those in China looking to travel to Europe, either for business or for pleasure. And it's certainly not good for the European businesses as well. So I certainly hope that we can move past this.
Antoine, what's your take on this? Do you think that the European Union is justified in placing heavy restrictions on Chinese travel?
Oh, I'm not thinking that the European Union are placing heavy restrictions. They are just requiring tests, and particularly if they require tests at arrival, it is more for improving the information, because they are not confident. They do not trust in the official reports from China. It's not only China. There are many other countries in the world which are not very transparent in their information. Of course, China is not, but there are also some countries which have not a very robust monitoring and sequencing activity on COVID currently. So the European Union could extend its measures to many other countries where they are not confident enough, and they would like to open windows, if I can say that, on what is going on in these countries where the information provided by official channels is not so reliable.
Julian, if I can come over across to you, you're a virologist. Is it reasonable for the European Union to keep putting on restrictions based on new strains of a virus coming out when it's a relatively new, relatively novel virus? At this point, it's still only 3 or 4 years old. We're going to get new strains very frequently, aren't we?
Yeah, there are lots of new strains circulating, including the XBB variant from the US. There's been no testing or restriction of the US travellers. I think each country will have a different proportion of these different variants circulating within their population. And now that people are trying to live with the virus, it doesn't really make sense to pick out one country to screen for and not screen for new variants from other countries' travelers. And also, this screening method we know doesn't work very well. If you're not going to close the borders and insist on universal masking whilst ramping up vaccinations and updating them to the current variants, and we don't have vaccines that have the current variants in them at the moment. The most recent ones are BA1 or BA5 in the US. It's not going to make much difference. I think a lot of this is really a bit of pandering to the local populations that are scared about these new variants from China. But in fact, there are new variants from all the other countries, including North America, that we're not screening for. So it seems a bit more political than scientific.
Antoine, would you say that there is a risk here the European Union could look like it's pandering to fears of its domestic populations, or perhaps even that it's using this as an excuse to simply be beastly to China because the European Union's had a bit of a bee in its bonnet over the last 6 months about that?
No, again, I think the objective of these testings is absolutely not to reduce the spread of any variants. In that way, I am joining my colleagues, my two other colleagues. It's not nonsense, scientifically speaking, to hope or to expect to block any variants at the borders just by this testing. And closing the borders is not effective anymore with these highly transmissible strains. So the real objectives here are just to have better information from countries which are not providing this good information. Why we don't screen travelers coming from the USA? It's just because the US researchers and the US official data are very transparent and we know them on real time. We have a lot of sequences which are posted by the US government, and we rely on the figures which are provided. In China, when, for instance, maybe one example, the Chinese countries have reported a couple of hundreds of deaths due to COVID from December up to now. When Europe has reported more than 10,000 of cases in the total amount of time. So it's not credible. You know, the information which is provided by China on COVID today is not credible. So
let me put that question across to Andy. Andy, how do you feel about the data that comes out of China? It's a regular thing that gets leveled at Chinese data, whether it's GDP numbers, whether it's inflation numbers. These are COVID numbers. Are the stats to be believed or not?
I think they absolutely should be believed. But let me go very briefly back to a point that Antoine made that I'd like to elaborate on. These measures really are not that strict, but it's symbolic. And I think this is the issue, that I think it's meant, or it's seen as an insult to China and the Chinese people. And this is, I think, the crux of the matter here, that much, unfortunately, between the European-China relationship is motivated on the European side by a certain misguided hostility and animosity. And I think this leads then to the data question as well. So we all know there's different ways to report these statistics. So my understanding is that China has been reporting deaths from COVID, which is different than deaths with COVID. And to use an extreme example, if someone is run over by a car and dies and they were COVID positive, should that be reported as a death from COVID? Clearly, most reasonable people would say no. But there are more ambiguous cases as well. And as we know, this current wave of COVID in China has been thankfully and remarkably mild. But that does not mean that people, especially older people, more vulnerable people, have not died. In fact, they have. But I think it's a legitimate difference in how to measure these statistics. So I think to, as you say, levy these charges that the Chinese government is lying or not trying to be helpful, I think is completely incorrect. I think one can have different ways of measuring. Perhaps there's opportunities for harmonizing some of these numbers, because as far as I know, again, China is very, very committed to being a responsible member of the global community in every way, including public health.
Julian, how do you handle the numbers position in your job? Because you're right at the sharp end of having to look at figures and say, well, are these deaths from COVID? Are these deaths with COVID? We see average numbers coming out in the UK for number of deaths per week. Chief Medical Officer in the UK 2 weeks ago said that we had 800 deaths above average in the UK relative to a normal year. Only 400 of those could be ascribed to COVID, though, which leaves a big question mark as to what the other 400 are. How do you deal with the statistics and the numbers in this very contentious instance?
So Andy raised the important point that the way that death certificates are completed in different countries varies across the world. In the UK, for example, flu is rarely put as the first cause of death, 1A, if you like, on the death certificate, although flu can contribute to the deaths due to respiratory failure or cardiac failure in the case of those with comorbid conditions. The data coming out of China is different from the sequencing data that travellers will be giving at European borders. And my Swiss colleague is slightly conflating two different things. There's lots of sequences on Gisaid from China. Swabbing a traveller who's otherwise fit and healthy doesn't provide additional metadata as to inform Europeans about the cause of death for those people that are swabbed back in China. So that's a total disconnect. So that reason's really not valid. The other issue is how China chooses to define deaths from COVID. And it's a very specific definition, including radiological imaging as well as PCR testing for COVID, SARS-CoV-2. And one example of this can be seen in Belgium in the first wave of the pandemic in 2020, where the Belgians had the highest death rate due to COVID reported in any European country, including actually globally. And if you look at the reasons why, is that the Belgians certified as deaths from COVID based on symptoms only. You didn't even need to have a PCR positive result. Now, that may have changed later on, but it just illustrates the breadth of definition of deaths from COVID that you can get. So unless you understand a particular country's definition of the death from COVID, it's very hard to criticize in such an open way.
Antoine, back across to you. What do you make of China's response to the European Union saying, well, look, we'd like to have some more restrictions or some additional restrictions here and some additional testing for people coming in from your country?
But I'm very surprised that the Chinese people feel insulted by with the reason that we are just asking the Chinese travelers or the travelers coming from China, whatever their nationality, have to have a test. The China has blocked their borders for 3 years, during 3 consecutive years. Wasn't it insulting for all the other countries not to be able to come into the country? It was not possible. And now we are just asking for one test, and it is something which is insulting. I cannot understand that.
Well,
another point.
I'm guessing, I'll go to him in a second just to confirm this, but I'm guessing that Andy's position on this would be that it wasn't insulting for China to do that because it treated all nations that weren't China the same way. It's not like it treated Britain differently from how it treated Zanzibar. However, in this circumstance, the European Union seems to be singling out China and leaving Brazil, Costa Rica off the list.
Yes, you're right. I think it's a good point that it's not the only country which is not transparent or which is not reliable with its sequence. I just want to take one example regarding China. The 26th of December, Italy screened the travelers coming from 2 planes from China in Milano. And they discovered that 52% of the travelers were positive for COVID. And they said, we will publish the sequences. And a couple of days after, the 5th of January, the Chinese officially posted almost 1,000 sequences on GZAID, which is an open platform. I think because of this push from the Western community, the Chinese officials were much more transparent. So we need this pressure on Chinese government to be more transparent because we absolutely need their data. It's 1,400,000,000 people. It's not like Zanzibar, I apologize. It's a very, very large country where a very, very huge epidemic is occurring.
Well, let's have a listen, if we can, to some of the comments that have been coming out of senior EU and European officials on this matter. German Foreign Minister Annalena Baerbock in Lisbon for a diplomatic conference had this to say on January the 4th.
We need to take the news about coronavirus coming out of China very seriously, about which China has openly released very little information in recent times. It is not only the close European coordination that is so important, but also the work together with the WHO on full transparency about what the current situation in China actually is.
Andy, that's the German foreign minister basically giving China a little bit of a slap there, really, saying that they're not being transparent. Do you think that's fair or not?
I don't. I mean, I think this is conflating several issues here. So I think one, as Antoine mentioned, is sharing the sequencing of mutants, variants. The other is the actual number of cases, which I think is something that countries do care about. And then also is related to this is the infectiousness and the severity of the variants. And again, I will defer to our other guests who are experts in this area. But my understanding of the latest outbreak in COVID is that the R0, the infectiousness of it, is something like above 16, perhaps even 20, compared to the original Delta variant of 2, which is much, much more infectious, but much less fatal, with the CFR, or the case fatality ratio, a small fraction. So if that's indeed true, and the data in China seems to be bearing this out, it really doesn't matter how infectious, how many people in China are infected with this, because the symptoms are so mild. So I do think it's a bit disingenuous for the German foreign minister to say this. And I would also push back a little bit on what Antoine said, in that I'm pretty sure it wasn't Italy testing people from China that caused the Chinese government to release more information. I think these are completely separate tracks in terms of bureaucratic reporting lines. And again, as far as I know, the Chinese government is very, very committed to working with multilateral organizations like the UN, World Health Organization, et cetera, to stopping the spread of public health crises like COVID.
Julian, when the public health crisis first kicked off, and indeed prior to that, when people were extremely worried about the infectiousness of COVID-19, many of the academics came out and said there will be a lot of mutations in this virus. It will transmit very quickly, it will mutate very quickly. Eventually, we will end up with a transmissible strain that isn't that deadly, because that's just the natural evolutionary pressure on a virus like this. Is that what you see happening? Is that what you've seen has happened, given this latest variant out of China does seem to be fairly highly transmissible, doesn't seem to have quite so many health downsides?
Yes, I said this right at the beginning, and this is the way that all these respiratory viruses eventually evolve. If you look at the time frame over many years, the virus has no interest in killing its host. So, of course, the virus variants that survive and spread, rather than die out in killed hosts, are going to be more transmissible, less severe. So on a global scale, does it really matter what these variants are doing? Because for flu, we track flu, we adapt the vaccine to flu every year. The variants will start to matter if we do the same for COVID. But at the moment, as it gets milder and milder, you may find that the interest in getting vaccination against COVID may actually become similar to flu, in that those who are most vulnerable will get vaccinated every year, every season, and those who are less vulnerable may not bother. And then you'll have this partial take-up, which is reasonable given the lifestyles and survival probabilities of these different people. And then you get a kind of similar situation to flu globally. And with flu, all the countries are fairly transparent due to the WHO network of collaborating laboratories, and we should be looking towards that for COVID in the future.
Well, if I can bring in a quote here from João Gomes Cravinho, who's the Portuguese Minister for Foreign Affairs. I'm going to direct this in just a second back to you. Here's what he had to say about the current decisions that Portugal's putting in place on China.
In Portugal, we have not yet taken any restrictive decision regarding COVID measures. We have an extremely high vaccination rate. We are attentive to the variants and we remain attentive to the dynamics of COVID in China. Whatever decisions are taken will be purely for scientific and health reasons. There is no political motivation.
Antoine, so listening to the Portuguese there, this is part of an issue with the European Union strategy, is because they've left it up to each of their individual members. Some of them, like France, like Italy, have put in place one set of measures. Portugal, though, has said, no, we really don't see the need from a scientific perspective for changing what we're doing at present.
Yes, I think, of course, when we could have preferred a more coordinated position in the European Union, I don't think it's such an issue, because, again, it's not for trying to block or to protect or to reduce the risk of circulation of variants. There is no new variants currently from China. The only point is a lack of trust. I can understand that the lack of trust and transparency in Chinese data is not something the Chinese wants to listen. But if you do not trust the country, you implement some windows just to see what is happening in the travelers coming from this country, and you have a better information. And if one of the country does not play this game, that means we just have not this window open, but we will have that one from Italy, that one from Belgium, and that one from Germany and France, and that is something which is good, which improves information. And if the information overlap what the Chinese officials are publishing regularly, I think it is good. I think our lack of trust was probably a bit exaggerated. The problem is, you cannot impose trust. If you are trusting your partner, you do not try to gather more information. When you do not trust him completely, you prefer to gather the information you can.
But in this particular situation, the European Union has already, over the last 6 months or so, there have been various different suggestions. There's been pushback in Germany against this, but for the most part, the European Union has been moving in a direction of being a little bit more sceptical of China, wanting to cool its relationship with China, wanting to diversify away from some of its heavy manufacturing dependence on China. Does this not give the appearance of coming at a rather inopportune time for the European Union, when it could relatively easily just look the other way and ignore any changes going on in China in the manner that the Portuguese have already done? Is it not unwise for the European Union to pursue this course of action right now?
Oh, I'm not competent on this matter. I'm an epidemiologist, and what you are asking is more the geopolitics. And I'm not talking about geopolitics here. I'm just talking that what I want is good information from all countries. I just regret that from sub-Saharan Africa, the European countries do not proceed testing at arrival. I think we do not trust, not because of a lack of transparency, but because of a lack of sequencing. We do not trust what is happening in sub-Saharan Africa. So my thinking is that there are many countries where we would like to have more information at arrival. It's not a question of geopolitics or of politics here.
Julian, as the COVID-19 virus continues to mutate, what do you expect to come through in the future? Is it possible we could eventually have a full pan-COVID vaccine, or is that just pie in the sky?
Well, we've been trying for a full pan-flu vaccine for 50 years. It's not going to happen. These viruses mutate too much too quickly. And the problem is that individual host populations will actually drive viruses in different directions. If you have an mRNA vaccinated population, an adenovirus vector population, vaccine population, and then a whole virus inactivated vaccine population, it drives the virus in different directions. Traveling across the world will mingle the viruses to some extent, but I expect this virus to get more and more mild, more transmissible, and less severe as time goes on, as we've seen with the other seasonal coronaviruses. And I suspect that eventually SARS-CoV-2 will become like another fifth seasonal coronavirus, common cold virus, that people won't bother getting vaccinated against.
Gentlemen, thank you very much for joining me today, agreeing to talk about this subject. Remember, you can see more on the discussions and debates that we have here on Roundtable on our YouTube channel. If you head over to YouTube and search for Roundtable TRT World, you'll find us there. But for now, from me and all of the team here, goodbye, and thank you for watching.